Welcome to the Interprofessional Space podcast, where the spirit of inquiry meets healthcare collaboration. In our podcast, we discuss all things interprofessional education. According to the World Health Organization, interprofessional education, or IPE, is when students from at least two healthcare professions learn about, from, and with each other to improve health outcomes and enable effective collaboration. Welcome back to part 2 of our conversation with Tony Breitbach. In this episode, we continue our deep dive into all things interprofessional, exploring new perspectives and uncovering even more valuable insights. Let's jump right in. So I've encountered this in my practice as an IPE leader, and I'm wondering if you have as well. I suspect we all have. And that's when you hear from students that what we're sharing, what we're teaching them in our IPE activities is not what they encounter when they're in the clinical setting necessarily. So that, that theory practice gap. And so I guess my question for you is, are you seeing that? And how do you manage in those moments? And or even do you even preload while you're doing the activities to help students anticipate that they're going to encounter that? And how do you sort of manage that theory practice gap?
Absolutely. I mean, I think you must keep it real for the students, right? You to say here like everything is Disneyland, right? It's not, and I think that's why in the very first class we talk about how complex the system is and the challenges we face and those types of things. And we, but we continually bring in people. Like the second half of that first class is a steady stream of community members and healthcare providers and all these people talking about how collaboration is improved. So they hear this from they hear that it is happening. It just may not be happening where you're at, right? And the reason why it's not happening where you're at is because the system is complex and the system's hard. And sometimes when things are hard, people don't really feel comfortable stretching themselves a little bit. So recognize that from we tell them that it's hard to hold your 5 teammates accountable, right? It's funny, we do a team contract at the beginning of each of our courses, and part of it is how we're going to communicate, how we're going to hold each other accountable. And I went up to some groups this fall and I said, okay, how are you going to slacker proof your team? And they all look around like, none of us are slackers. I'm like, there's slackers here. Yeah. How are you going to slacker proof? How are you going to get to that point where you're working on a big project and you have someone that's just going through the motions and who's a slacker? How are you going to anticipate that? That's going to happen. And so have that conversation early, like, okay, we're not going to put your name on the assignment, or we're not going to do this or whatever. Like, then you can fall back on that. Same thing with we always should be teaching to the highest level of our scope, right? Also, so I mean, just because collaboration hard doesn't mean we should quit teaching it. Like we need to teach you best practice with the hope that and this is another thing I hope to instill in our students is an appetite for collaboration, right? We've all heard of the workforce challenges we have right now. And if our best and our brightest want to go to settings where collaboration works and collaboration is supported, guess what? They're going to get the best and the brightest in those settings. And so, our job as educators is to provide people with the foundation that they need and the skills. And also, one of the things we've been working on assessing here at SLU is this meta perception of their self-efficacy. So, because if they feel confident in their skills and they feel like what they're doing is valuable, the chances are they're going to want to put that into practice, right? So, because if they're not confident in their skills, they kind of get that imposter syndrome. They're like, oh, I don't think I quite do this. And if it's and then what you just talked about, and But if they don't feel like it's valuable or it's valued within the system, they're not gonna prioritize it, because like, you know what, I'm never, this is beautiful, but I'm never gonna use that stuff. Like, really, come on. So what we've done is we've actually developed this meta perception kind of instrument that we're piloting this fall, where it has four constructs. It has, how do I feel that I'm contributing on my team? How does how does our team feel that we're contributing? The other one is, how do others view my contribution? That's the third construct. And how do other teams view our team's contribution? And so not only are we thinking about how we do it, as it how do other people feel that we're contributing? And if we can grow the students that meta perception, that self-efficacy, that they feel that there's real value not only in themselves but also how others view them, I think it's going to, increase that, irregardless of what they're going into. They'll feel that, hey, what I'm doing is valuable and I'm going to fight for it, right? And so that's number one, preload it, realize that this whole thing's hard and we're in a very complex system, but give them the confidence that they can say, you know what, I can be an advocate for this moving forward. And I can seek settings where I see, because they go out on clinicals, right? They go out on, and they're like, they'll go out in one clinical like, hey man, they got it figured out here. And another place is like, oh,
Yeah.
I couldn't work at this place in 100 years. And it's funny, what's funny about this is that in athletic training, because of the way the conferences and everything cropped up, the SEC conference and everybody kind of comes from a tree of athletic training. So like everybody in the Big Ten kind of comes from the person that used to be at Purdue, and Pinky Newell is his name. And so the way we used to always know a good reference is figure it out who they worked with. Like, where were you at? Where'd you work? Because we know the places that do things right. That's the way it used to always be. Like, who'd you work with? Like that type of thing, like that. Now that it's getting so big and complex, you can't really do it that way anymore. But in the old days, we used to do it that way. And you can't do that within the healthcare system, right? I mean, a hospital, like,
Right.
you might have worked with this person for 8 hours 2 weeks ago, but they don't work with them anymore. So the thing is so what we're hoping is that different organizations have the structure that supports collaboration, and our best and our brightest want to go there. And I think, and then they're going to build best practice and they're going to move that forward. And it's not an easy process, and I think, and then you look at, England, like the NHS, you have support in principle, right? But then they have to put that support into practice, right? I mean that's one of in the United States, we have plenty of access to healthcare, especially if you can afford it, if you have money, you know, um, but it can be inequitable. You technically have access to healthcare in the UK,
Yeah.
but because the system is so overwhelmed sometimes that you
Yeah.
truly might not. And so as a result, the nice thing about, to have the government come and say, we want to support collaboration, but then when you try to put it into practice, it can be difficult, right?
Yeah. And I think that's a good point about practice. I'm also wondering, we sometimes, and I guess I don't like to talk about this very often because I think sometimes it's like, oh yeah, I know it takes a lot of support for interprofessional education programs, and I think in order to make it work, it takes a lot of support from the institution. It takes a lot of support from colleagues and educators, but there are people who don't support it, I think, and even within health education and likely within, our universities. How do you deal with those people, I think, and kind of managing that, and what's your tactics or
Um,
strategy?
you can use a carrot or a stick, right? You can, um, the stick is accreditation. Nearly every one of our health professions accreditors require it. So if you want to use that stick, we use the accreditation stick. If you want to use a carrot saying, you want to know something, you know, this is healthcare the way it should be delivered, right? We can be aspirational. We need to provide our students with that foundation. The other thing that gets used a lot by the naysayers in IPE is, where's your proof? Where's the evidence? Those types of things. But however, there's not, and I think sometimes we're a little hard on ourselves as IPE scholars, right? There's like, I gave a talk at the IPEC meeting this summer where I talked about interprofessional education scholarship, right? You'll hear the people saying, how do we know it changes practice? Like, how do we know that? Like, but is it our duty isn't it practice's duty to show that? Because we know that poor collaboration definitely produces bad outcomes, right?
Right.
And one of the things that IPEC has done now with the new competencies is the fact that we're not kind of reinventing a new version of communication and of team science and all of these types of things. There's a science behind that, right? So really what we're doing in interprofessional education is we're taking this known science and teaching it to health professional students in a collaborative manner. And if we're a really efficient way of, and we assess that, and we do a good job of assessing that. If we show that we provide a very efficient way of giving our students the foundation for collaboration on graduation, we got to put a little bit of the onus on the practice side. Like they need to support collaboration in their setting and not rely on, well, what other industry where education changes that is expected to change the actual, the way industry works, right? Not too many places are like that, right? So our goal is to provide a collaboration ready workforce. That's what we do, right? And when people say, well, we don't know that, we know that collaboration makes a difference in healthcare, right? Have you ever done a root cause analysis? Guess what? In 90% of the root cause analysis, it comes down to poor communication, conflict, all the kind of things like that. So the reality is that we've got to be willing to say our duty as educators is to create a collaboration-ready workforce. Their duty as on the industry side is to facilitate collaboration to help produce safer, more equitable, more accessible care. And if we both do our job, guess what? That gap gets narrowed, right? If we feel like one's got to prove the other, then it's not. And that's one thing we've done with ASAP. We've created these regional summits where we found that industry doesn't come to a big meeting, a big educational meeting. Like they won't come to a big conference somewhere. But if you leverage your institutional nature of your university and reach out to your local clinical partners and say, hey, would you come in and have a conversation with us and talk about these issues and give them a way of interacting? So we've developed this ASAP stakeholder engagement model where we do these summits, and we actually do it on one day synchronously. We do it at 6 different sites in person. So for example, last year we did it in Birmingham, Orlando. We did it in New Jersey at Seton Hall. We did it in South Dakota at Sioux Falls, South Dakota, at University of Utah, and at Galveston, Texas. So we did it in 6 sites. And then at the end, and we use this stakeholder engagement model, which is really kind of a World Cafe, but we tease people out more by their professional roles. And then what we do is we actually do a nationwide harvest then. So then all 6 of the hubs get on Zoom and we discuss what we talked about in those sites. And I'm telling you that those have built such good relationships in those communities between industry and academics that they continue to meet throughout the year. They, even when we move on to a different city to do one, they continue to have those meetings as they go forward. And that's where the voice of industry can come into education in your smaller environment. To expect them to come to the APTA meeting or the AOTA meeting or NATA, or the Nexus Summit. I mean, we'll get a few people that'll show up, but not the voice that we need. We need those clinical managers. We need those people that are the boots on the ground people to come in and say, and they need to shake us by our collars every once in a while. Hey, you need to teach them more stuff. They graduate and they're not information literate enough, or that we have to retrain them all this stuff. Like, then I'll be like, then get a consistent electronic health record. That'd be really helpful. But 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 that's above my pay grade, right? So anyway,
Now you're just talking crazy,
the
right? You
joys of
can't.
a fragmented healthcare system, right? Anyway, so the thing is that's one thing we found. And so all of these, you mentioned all these things that I've been involved with, and that's one of the things that I've really tried to do. And I think this could be a good segue into maybe one of your other questions. Is one of the things that I try to do is try to build understanding, because most of these interprofessional organizations, they have no idea what the other groups do. And I've been on the leadership team for a lot of these organizations. And one of the things that I feel very passionate about is if we truly know what the capabilities are of all of these different organizations, they all have their strengths, they all have their ability to contribute. If we work together better, we can all elevate rising tide lifts all boats, right? We can all work together to, certain, the institutional nature of ASAP membership makes it easy for them to connect with industry. The content experts of the members of AIHC and the connection to the National Center gives them that bullhorn and of an expertise around theory and all those types of things. National Academies of Practice, you have 16 different professions that all have their own academy. So when they go forward and do advocacy, they can say these 16 professions all agree that this is a good idea. Those types of things. Interprofessional.global, they're a flat organization. They have the ability to uplift all of these regional networks on their own terms, right? The needs of Africa is very different than the needs of the UK or Canada or South America or Australia. And so to be able to have a flat organization like that that does that can be another thing. Interprofessional Research.global, they're very nimble and they're focused on projects and they get a lot of things done that way. But they don't have to be as flat as Interprofessional.global does. So a lot of different organizations, and I think as we understand, IPEC has the operational the competencies. They have that. The Global Forum has the ability to put things in reports in front of lawmakers and policymakers, which is really, really important. So if everyone understands kind of the strengths each other brings, I think it's a real plus.
Mm-hmm. So, I mean, I've worked with you on a couple so I'm on the communications group with you with interprofessional.global, and I've seen you at conferences, and I feel like you have so much going on, but you always seem to be on and to like know what you're doing, and you come across really well, and you're lifting everyone up, and you're very positive, and it is a joy to be around you. But how do you manage it all? Like, I mean, I'm genuinely in awe.
No, it's funny. People ask me that about social media too. So, there's a thing called being a trusted source, right? And because of the way information is shared in today's society, and even in the educational literature, you need people out there kind of triaging information, right? Or actually sharing stuff out, because not everything is in every database, not everything is accessible. So I think it's really important. Number one, I do that because I really like doing it. Like this is fun stuff. This is what I really enjoy. I love interaction. And not only at the professional meetings, which are really great, but also, at the pub in conversation afterwards. I think there's so much can get accomplished when you're in social settings at those types of things. But once you build that build those connections and you become a trusted source, there's almost a duty to keep, I had a marketing communications person talk to me one time that she said, starting social media accounts is like buying a puppy, right? You've got to feed it, you got to give it water, you got to let it out. If you never post anything on social media, you become irrelevant. Like nobody looks at you anymore, right? So part of my focus on being active on social media is really to continue to be a trusted source, be a resource for my colleagues. And really most of the stuff I share out is like, hey, this was cool. Like, check it out. This is cool, and I have some efficiencies built into the system. So you have kind of three different buckets of platforms. You have LinkedIn, X/Twitter, and then you have the Meta platforms, which are Instagram and Facebook. I usually always first I identify something. I I've got a little shorthand for how to do posts. I always do it on LinkedIn first because it's the easiest and you can edit it easy. You can tag people really easy. And so one of the things I've tried to do is with the organizations that I'm affiliated with is I encourage them to get LinkedIn pages because LinkedIn's algorithm really helps people create connections with each other, right? People will be suggested to you based on the fact that you're in NAP or interprofessional.global or one of those kind of things. So then I take that and then I go to Instagram. Instagram doesn't post links in Instagram, but it also automatically posts to Facebook. So then you post it on Instagram, goes to Facebook. And then the last thing I do is Twitter, because Twitter's restrictive on their character limits. So you have to be, and you can't edit them. So you got to make sure you have your message really well defined by the time you put it on Twitter, because it's the one you have to delete it and then repost it if you want to do it. So and literally I've gotten to the point where I can do it in like two things. I can do it in like 10 minutes. I can post in 4 sites in about 10 minutes. It's not hard. And number two, you get a knack for what people like. Like you get a knack for what draws eyeballs, right? Or what draws likes or retweets or whatever you want to call it. So once you do it for a while, it gets, and I think we have a great team with Interprofessional like Global. We've kind of divided and conquered. We have other types of messaging, but I think it's just one of those things where you can do it. You just have to build efficiencies into what you do. But if it's what you really like to do, it's not hard. It's you and I use times that are like, while I'm sitting there eating my Cheerios in the morning and watching the news, I'll quick just blow through the social media things and share a few things. And that's usually, I don't use my prime time to do that. I usually use the little gaps and those kind of things. Did that answer your question?
Yeah, I think so. I mean, yeah.
Yeah.
I mean, the whole part about being engaged and being excited is just, I like, if anyone who goes to an interprofessional education conference will never look at their other professional conferences the same way. Because everybody that goes to the IPE conferences drinks the Kool-Aid. Like we go to all the meetings, we engage with each other. Most of us, when we go to our professional conferences, we end up hanging out with the same people we've always hung out with all the time. Whereas at the interprofessional conferences, you always make new friends. You always build your network. You always are. I walk out with, another 25 LinkedIn connections after one of these conferences. And where you go to your professional ones, you hang out with the people you work with at your school, maybe some people you went to college with. But other than that, you don't really venture too far away because they're really huge conferences, number one. And number two, you don't really naturally interact with them that often.
Yeah. No, I agree. And I know for me, that's part of the IPE conference is trying to find people and like-minded people at other places and then connecting with them. So
Oh,
I
yeah.
guess yeah.
And because we all value it, we just feel very open to it, right? It's not hard.
Where do you see the field of interprofessional education heading in the next 5 to 10 years?
Okay. I talked about this earlier. Where do I want them to go and where are they? Like the reality is this, is we are very, very dependent on the goodwill of our constituent partners. And if we can get into a situation where they start seeing more carrots and need less sticks, that would be great, right? To get that buy-in, that become part of your culture. What I would love for the universities and faculties to realize that if we embrace interprofessional collaboration, it'll make our everyday be better. I mean, and so I would love for it to become the culture of institutions as being something that is, of course, this is what we just do, right? However, we really rely on at this stage of the game, we really rely on the good, because it's not hardwired into our system right now. We really rely on the goodwill of our administrators and our champions and those types of things like that. So it's very tenuous right now. And I would love for in 5 to 10 years, I would love for us to be in a situation where it becomes more hardwired into our system. I also would love people to be able to hang their faculty hat on being an interprofessional education educator and scholar and those types of things like that. But that comes also with a duty that we need to have rigor in what we do. We can't just, like, hey, we're all having fun in the sandbox. We must be doing something right? Like, we need to track our outcomes. We need to hold ourselves accountable from a rigor standpoint and those types of things like that. So I think can the people that are doing it, feel the value and feel like it becomes part of our culture, and the programs and the students who go through it feel that this is just what we do, right? That's what I would like to get to. And then universities would fund it appropriately, and departments of education and education ministries and all those types of things make it a part of the standard requirements for education. So
Yeah. Thank you, Tony.
Right.
All right. So we should get to some fun ones, Anne. This is
Sure.
your baby.
Right.
So-
Well, having watched that show Inside the Actor Studio, I
Sure.
just am always entertained, and I'm always surprised by some of the answers that they give. So we have a little bit of a version of that. We took some of those questions and we added a few more. And you're free to not answer any of these,
Okay, that's fine.
just so you know. So what is one thing about your own profession that you wish other team members knew, or sort of similar, what is the greatest misconception that others have about your healthcare profession?
Okay, I'll keep it on the positive. Okay, so I'll make it about. This is what I'm trying to instill this in my colleagues, is that your superpower is care coordination. We're in a system that care coordination is really challenging, and athletic trainers really, it's part of our nature. All we do is coordinate care all the time. I mean, we're parts, every context that we have, we're parts of teams, right? So to have more professions realize that having an athletic trainer on your team will improve your care coordination. I think that's probably the thing about my profession that I take a great amount of pride in and try to instill in my colleagues, saying, know your superpower. It's care coordination. We're really good at it.
Right.
Sure. Awesome. Okay. Do you have a favorite medical word? And what is it?
Oh, favorite medical word? I don't know. I can tell you one of the favorite words that I use in my work
Okay.
is serendipity.
Serendipity is a great word.
Serendipity is awesome. When you feel that serendipity, like, and you feel it a lot, like we talked about those interprofessional education conferences, you go to them and like, yeah, I don't know what it's supposed to be looking for, but I know what it feels like when I do it. And serendipity is that, like, when you run into the right person at the right place, and and you're like, hey, this works. This is good. Yeah, that type of thing like that. So I'm a big believer in serendipity. Like if you can recognize that, you build a lot of really good collaborations and friendships, and it's pretty cool.
That's fantastic. What is a profession other than your own that you would like to attempt?
Other than my own, I would like to like test drive or something like that. Uh, I an obstetrician or midwife. I don't, I didn't sign up for that, but I think delivering a baby is one of the most amazing things in the universe. It's pretty awesome. Yeah, it's
It
pretty
really
cool.
is. Yeah.
It's pretty wild. Yeah.
Right.
The fact
So
that
I
it even works. Like this really happens. This human comes out of this person.
It is amazing, isn't it?
Yeah, it's a miracle every single time it happens.
It is. I agree.
okay, mine's less yeah. What is a sound or noise that you love?
This is comes from my athletic training background. What I like is when I'm at an athletic event and there's a really big crowd there, and you're standing, you come out in the tunnel, and there's no announcements or anything going on, but it's just loud. Like it's just everyone's talking to each other in the stadium, and you're like, this is gonna be a big day. Like you can just feel the energy, that kind of that loud kind of just humming roar that you kind of feel as you're walking out the tunnel. That's the reason why I love athletic training. I mean, I love, you know, the reason why I love athletic training is I love being a health professional. I love taking care of people, and I love doing it in a really cool setting, which is sports. There's nothing like, you know, taking care of somebody in front of 15,000 people, which I did regularly. With basketball. One of our players go down. Kneeling on the floor in front of 15,000 people. They're looking at one spot. They're figuring out what's going on with this person, and we have to make a quick triage decision. Well, do we got to call an ambulance? Do we need to carry them off the floor? Can they walk off the floor? Can they, and those triage, those care coordination decisions we have to make every single time. So, yeah.
All right. And what is one career you imagined doing when you were a child?
Hmm. Um, I don't know. I think every kid in the United States that grew up in the 70s wanted to be an astronaut. Like we all wanted to. I mean, I'm of a generation, right? Like now kids grow up and people go into space all the time, but 1968 when they landed on the moon, that was a pretty big deal. And I was like 6 or 7, and it was yeah. I bet it was that. I mean, like you want to do that, it's kind of the things that used to be really, really in healthcare, we see that all the time. The things that used to be like we'd never see, now we're like, oh, that's a piece of cake. We can manage that. That's no big deal. Yeah.
Right.
I tell our students that I'm teaching you to work in a healthcare system that we don't even know what it's like. Like we're going to give you a
Right.
toolbox that you can go into this new, brave new world, this new healthcare system, and be able to thrive, right? And because we're not teaching you, I mean, we'll learn from today's lessons and yesterday's lessons, but you're going to be the one that chart the path. We need to give you a toolbox of things you can do. You can work with others. You can build a better system, and I think that's one of the things. I mean, I think back about for example, an ACL reconstruction and a knee. It used to be 18 months, like, and they'd roll the dice if you'd even be able to come back and play from it. Now it's like people are back playing in 6 months and
Yeah.
8 months, and
Wow.
and they're good every time. They're even faster after it than they were before. I mean, it's amazing the art and science of what we do is just improved dramatically.
Tony, so thank you very much
Yeah.
for coming with us today and for sharing everything. It's been such a pleasure and a joy. And then for those that are watching or listening, so if you're interested in contacting Tony, we're going to include his contact information in the show notes, so you can go there to see those.
Yes, thank you very much, Tony. We appreciate you taking the time to be with us today.
It's my pleasure. I love working with you both, and I really admire everything you're doing to elevate healthcare, elevate education, and keep up the good work. And hopefully we'll see each other in person sometime soon. So thanks.
Great.
Thanks. So before we sign off, we want to remind you, whether you're a student, a practitioner, or an educator, the work you do is important and it can be very stressful, but you are not alone. Please take care of yourself. Let's look out for each other, and we hope you can join us again soon.
Thank you for joining us for part 2 of our conversation with Dr. Anthony Breitbach. Ann and I had such a great time talking with him, and we hope you enjoyed it too. If you missed part 1, you can find it in our episode list. And if you want to get in touch with Tony, you can find his contact information in the show notes.